This presentation is intended to provide an overview of findings from a community and partner engagement report created to inform the Colorado Oral Health Strategic Plan. The Colorado Department of Public Health and Environment, or CDPHE, is in the process of developing a statewide oral health plan focused on achieving oral health equity. They have engaged Joining Vision and Action, JVA, a Denver-based research and planning firm, to assist with this process and are working in close collaboration with members of underserved, poorly served, and never served communities to design this plan. A plan design team consisting of representatives from community-based organizations and human service agencies was formed at the start of this project and has provided leadership and oversight to ensure that the plan development process is considering equity every step of the way. Over the past several months, JVA facilitated a comprehensive community and partner engagement process to gather input from a variety of voices who will be impacted by the final plan. Findings were compiled into a report and key highlights will be summarized in this presentation. The engagement process involved conducting virtual focus groups with community members in both English and Spanish, and interviewing partners within and outside of state agencies. A survey was also administered to partners across the state working on issues related to oral health. The goals of this process were to learn about the needs and barriers faced by the community and to identify opportunities for collaboration and strategic alignment with key partners. Through the engagement process, we heard from a wide range of community members and partners. Focus group participants came from all over the state and included diverse representation from communities of color and other historically marginalized groups. The plan design team was integral in helping us connect with community through these focus groups, and we had such a positive response to recruitment efforts that we had a long wait list and will conduct additional groups in the future. Interviews with community-based agencies, foundations, membership associations, researchers and educators, healthcare clinicians, policy advocates, and state agencies and programs helped us develop a clear picture of the current state of oral health in Colorado and the needs of the communities and potential solutions to get there. There were some groups that we had less representation from than we would have liked, so we recognize the need to elevate these voices in the future and will continue to work with partners to reach them. We're immensely grateful for the support we've received from partners and the plan design team thus far. We also recognize that because of COVID-19 and the ongoing concerns about public gatherings, we chose to conduct all of our focus groups online via Zoom, which may not have been accessible to some of the groups that we wanted to reach. In the future, we hope to be able to conduct additional focus groups in in-person settings to be able to better access some of these populations and make engagement more possible for them. Some of the groups that we hope to reach in the future include more older adults, more people living with disabilities, more members of the LGBTQIA community, members of the refugee community, people experiencing homelessness, people who speak languages other than English or Spanish, consumer protection professionals, and oral health clinicians working in home and institutional settings. And again, we did hear from members of all of these groups through the process, but we recognize that there's more that we have to learn from these individuals and hope to further engage with them in the future. Before we discuss the key barriers that were identified through the engagement process, we want to acknowledge that much of what we heard was not surprising and represents outcomes of systemic inequities. While the barriers we heard about are very real and very much need to be addressed, We also recognize that some of them are surface level, and we hope to be able to address the root causes at a systemic level as we move forward with the development of this strategic plan. That said, the key barriers we identified were grouped into three main categories: access to oral health services, workforce limitations, and funding challenges. We also heard quite a bit about challenges related to the collection and coordinated use of data. Again, we recognize that many of these are outcomes of our current systems and will require system-focused strategies that can impact them from an upstream perspective. Partners we spoke with had a variety of recommendations for addressing the barriers and achieving oral health equity. Key themes revolved around the integration of oral health with other health systems, coordination among partners doing oral health work, increased use of technology for data sharing and oral health services, improvements in training and education, more flexibility and transparency in funding, and creative solutions to make oral health services available in community settings. Based on partner feedback, we were also able to summarize what health equity means to those working in this area in our state. Health equity means everyone gets the services and resources they need in order to have opportunities to get and stay healthy, regardless of identity, geography, or insurance status. Policies and practices designed to meet the needs of the most vulnerable, historically underserved populations will benefit everyone. Overall, we learned that there is a great deal of energy and enthusiasm from professionals engaged in oral health work and from members of the community to develop and implement actionable strategies for improving oral health equity in Colorado. We heard many great ideas for solutions and possible outcomes of a strategic plan, and partners were loud and clear about the need to revive some sort of coalition to support the coordination of efforts, funding, communication, outreach, and unified messaging strategies to work toward oral health equity in Colorado. An effective public health approach to achieving oral health equity for the state will emphasize upstream interventions that address social determinants of health and reduce the systemic barriers that contribute to oral health inequities. Thank you for taking the time to review this presentation, and thank you to all of the partners and members of the community that we've worked with for your commitment to achieving health equity in the state of Colorado.